Hi, everybody. It's Jessica Stone at Stansberry Research, along with Amanda Cuocci from Health and Wealth Bulletin here at Stansberry Research. And Amanda, we've seen many warnings, of course, to people around COVID-19, people that are immunosuppressed, people that are elderly, but there's actually real reason for men to be concerned because they're dying in higher numbers than women are. What's going on?
That's right. And that's a trend we're just starting to see now that we're getting some of the data in. There isn't a lot of great tracking for demographic data, but we have seen in places like China, France, Italy, South Korea, they're all reporting that men are dying at much higher rates than women. And now in the US, we're starting to see that cases in New York, I think it's almost twice the number of men are dying than women.
Wow.
So we are still kind of in the beginning of this here in the US to see what this data is going to shake out as. But we're already seeing that trend, and we've seen it before in other viruses, so we are a little nervous about that.
What are scientists going to be looking at this point to determine why this is happening? And are there factors we already know about men and women that could be contributing?
Sure. So one of the biggest ones is, you touched on the elderly and the immunosuppressed, but another one is anyone with pre-existing health conditions. So things like heart disease or other pulmonary diseases, like COPD, those are also disproportionately in men than women. So that's already setting them up to have, worse responses to any kind of COVID infection.
So, how should men be viewing their level of risk right now? And what are some things they can particularly pay attention to?
That's a great question because men are at higher risk. I think one of the things I wanted to touch on is, women have stronger immune systems. It's linked to the X chromosome. I'm not going to get into it all right now. But because of that, because men already know they're kind of at a disadvantage for your immune response, you really want to work on building that immune system. So things like eating really healthy, getting lots of vitamin C, going out in the sunshine, vitamin D is a great way to boost your immune system, exercise, and sleep. Sleep is really important. It's often overlooked, but getting enough sleep will repair your body and actually keep your immune system strong. So even if you're facing a lot of anxiety right now, trying to get those solid 8 hours is really important.
So this might be another area where we have to give men a little more credit for feeling more sick than we do when we go through something, but also put them on guard against other illnesses just like COVID-19 or other kinds of flu. Well, thanks for your time, Amanda Cuocci. We appreciate it. And if you would like to see more content just like this, please subscribe to our YouTube channel, or you can, of course, follow us on Facebook, Twitter, or Instagram. That's all for now. Thanks for joining us.